Ladies and gentlemen, I'm your host, Dr. Nigar, and today we're delving into a fascinating topic that has been gaining popularity in recent years, which is cosmetic gynecology. In the recent years, there has been a noticeable increase in cosmetic gynecology, with more women opting for aesthetic gynecology procedures. According to recent studies, the demand for cosmetic gynecology procedures has been steadily growing, driven by factors such as changing beauty standards and increased awareness of available options. Today, we will be exploring this expanding field of cosmetic gynecology, exploring its various facets and implications. Joining us for this enlightening discussion is Dr. Mustafa Aldam, a distinguished obstetrician gynecologist with over 2 decades of experience. Dr. Aldam's expertise spans over obstetrics, gynecology, laparoscopic surgery, and cosmetic gynecology. He is actively involved in national and international conferences on women's health, obstetrics, as well as gynecology, with prestigious positions and affiliations, including Fellowship of Cosmetic Gynecology. Also, Dr. Mustafa is the president and founder of International Association of Cosmetic Gynecology and president of the Middle East Gynecology Conference in Dubai, which is known as MIGO Dubai. Dr. Aldam is a leading authority in this field. Let's welcome Dr. Aldam as we explore the intricacies of cosmetic gynecology and its impact on women's health and well-being. Welcome, Doctor.
Thank you, Dr. Nika. Thank you for this nice introduction. Thank you very much.
Thank you so much for joining us on our MedSynapse platform on this very interesting and unique topic. Dr. Mustafa, to begin with, what are the most common procedures or treatments patients seek in aesthetic gynecology?
You know, Dr. Negra, the aesthetic gynecology or cosmetic gynecology, and now we start to call it the functional cosmetic and functional aesthetic gynecology, it started to booming. A lot of ladies, they want to do aesthetic procedure for their intimate area. We receive a lot of patients for the labioplasty nowadays. A lot of patients, they are unhappy about the shape of their labia, and they ask to do a labioplasty. Vaginal tightening procedures. A lot of ladies, they are asking for vaginal tightening procedure, vaginoplasty, perineoplasty. Actually, they're concerned about the beautification of the intimate area. How to make this area more beauty, more tight, how to lighten the color of this area, make it pinkish color, how to beautify the intimate area. This is a new emerging subspecialty of gynecology, and it has a big concern of most of my patients.
Thank you so much for the brief introduction, Doctor. It's very interesting to learn about the diverse range of procedures that are available in aesthetic gynecology. Now, moving on to our next question, which is on patient safety. Dr. Mustafa, how do you ensure patient safety and satisfaction in aesthetic gynecology procedures?
Yes, this is very important question. Patient safety is our concern. And how the patients become satisfied after the procedure is very important. By do a clear communication, establish an open communication with the patients, try to make sure that the patients have a realistic expectation, and to remove all their concern and to talk about their desired outcome. You have to make sure that the patients have a realistic expectation, what the result they are looking for. You have to make sure from the outcome of the patients and understand the patient risk. If the patients come to you and bring the photo of Kim Kardashian and she asks you, I want to be like Kim, so tell her Kim is not from this planet, it's from another planet. So the patient should have a realistic expectation. And also, it is the responsibility of the patients to choose a qualified, with a well-experienced doctor. It is the responsibility of the patient to choose a good doctor. Go for a qualified doctor. And try, when to speak with the patients, try to personalize the approach for the patients. tailor their treatment according to what they want, do a pre-procedures preparation, post-procedures care, continuous feedback from the patients in the recovery period. Always ask what bothers the patients, how is her, how she's doing, if she have any concern, if she have the infection, if she has anything. Always take feedback from the patients and try to improve yourself from that feedback. So this is the most important things from my opinion.
Thank you so much, Dr. Mustafa. That was very clear, especially when it comes to creating a trust between the patients and maintaining clear communication and being realistic with the patients is very crucial in achieving successful outcomes. Now, moving on to our next subtopic. Dr. Mustafa, could you please explain the process of consultation and assessment for patients interested in aesthetic gynecology?
First, we have to see the patients, to discuss with them, sit with the patients, take a brief history of the patients. How old is he? She's married, unmarried, or she's sexually active or not sexually active. She has kids. She underwent previous operation. How is her medical health? Her previous medical health. If she received any medication, if she take any blood thinner, if she take any antibiotic, or if she take any special medication for any special disease, you have to take the whole history from the patients. Then you go to her concern. Why is she visiting you? What is her concern? She doesn't like what she doesn't like. She have what bother her? Her large labia, her wide vagina, or the color of the area. This is, you have to sit with her and go with each concern for her in specific. So this is how we start the consultation with the patients, and then we talk about the procedure that we have, the option that we have, the pros and cons. What is the complication that could happen? There is no surgery without complications, so we discuss all the complications that could happen for the patient from that procedures. We go through all the procedures and the complications that could happen. How to prepare herself, what she have to do after the surgery or after the procedure.
Dr. Mustafa, now when it comes to the advancements and innovations, what advancements or improvements have you seen in aesthetic gynecology in the recent years?
Look, in aesthetic surgery, it is every day we have new innovations. Several innovations aim to improve the aesthetic and the functionality of the woman. Certain procedures like vaginal rejuvenation, which is booming right now also, can enhance the vaginal tightening and the sensation, and potentially improve the sexual satisfaction of the ladies and her partner. There is a lot of advancement in the technology, in the laser technology. Every day we have a new device, laser device. Every day we have a new laser, radio frequency, HIFO. There is a lot of technology in the field. Microneedling. There is a lot of technology in the aesthetic field. And this technology also become less invasive. More enhancement of the technology, less invasive, and all of this technology improve the functionality of the women, reduce the downtime, reduce the discomfort, become more effective for the women. So there's a lot of technology in the market.
Now, coming to our final question of the day, what are some of the key considerations or contraindications the healthcare professionals should be aware of when recommending aesthetic gynecology procedures to patients?
As a healthcare professional, should consider factors such as the physical of the patient and the mental of the patients. You have to make sure that your patients have a realistic expectation. You have to understand the potential risk and the complication. You have to take a full informed consent form, and you have to keep in your mind the ethical concern when it comes to your patients. There is a lot of contraindications for like a certain medical condition. If patients have medical condition, diabetic, hypertensive, high blood viscosity, if she have cancer or anything, so you have to put it in your mind. If the patient is pregnant, she have active infection, you have to keep in your mind that you will not operate on the patients who have an active infection on the side of the surgery. You have to treat the main issue first. You have to treat her medical issue in the beginning, then you can do this aesthetic. Remember, this aesthetic and this cosmetic procedure are elective. It's not an emergency procedure. So do it in a proper time. Make sure that your patients have realistic expectation, as I mentioned before. Make sure that your patients doesn't have a psychological problem like some disease, which body dysmorphic disorder. This is the most important things when you come to your patients. So do comprehensive pre-operation or pre-procedure counseling for your patients.
Dr. Mustafa, thank you so much for sharing your knowledge on this fascinating topic of aesthetic gynecology. Your expertise made it clear to us on the procedures that patients seek and the advancements that are shaping the field of gynecology. Thank you so much for tuning with us today.
Thank you, Dr. Negra. Thank you very much. You're welcome.
Looking forward to many more interesting topics to discuss together, inshallah.
Thank you, Dr. Negra.
And to our audience, thank you so much for tuning in to this engaging discussion. Stay tuned for more interesting episodes as this. Thank you and goodbye.